So my name is Robert Fishwick, RRT NPS. I'm a registered respiratory therapist, and I've been an RT now for over 25 years. I'm the manager of the respiratory care department at the hospital. We've actually had quite a few really good examples of where we've treated various types of patients with hypercarpic or type 2 respiratory failure with maskless, non-invasive ventilation. I can think of one afternoon we had an elderly gentleman with chronic obstructive pulmonary disease who was exhibiting exacerbation, who EMS brought in. His gas was, his CO2, if I remember correctly, was in the 70s, and he was down in the 720 phase. And at that point, when he arrived, he was a little bit more in the obtunded stage, and we were kind of very cautious about wanting to put a mask over his face and increasing the risk of aspiration. So after an academic discussion with our ER provider, we decided to intervene and use maskless high velocity nasal gas insufflation with Vapotherm. We set the patient at 40 liters a minute and 100% FiO2. And again, we had to coach the provider a little bit because mask non-invasive ventilation is kind of what everybody wants to run through. So it was a little bit of helping the provider to understand to give it some time, to be patient with it. His oxygen saturations came out of the low 80s up into the 90s. And about an hour and a half later, when we drew on our second arterial blood gas, he had brought his pH back up to the fairly normal range of 732, and we got his CO2 down into the 60s. The patient was more awake, he was breathing more comfortably, and we consider that quite a success with maskless non-invasive ventilation. You know, when patients come into the hospital and they're experiencing, whether they're hypoxic and they're in respiratory distress, or they're hypercarbic and they're in respiratory distress, they just want us to help them, right? That's why they're there. And it's our job to provide interfaces that work the best for the patients. I've worked with many different systems over the years, and I have to say that I truly believe that the Vapotherm device is probably one of the best on the market that interfaces so well with the patient, right? Not only are you giving them adequate flow so that they breathe more comfortably, we're giving them the oxygen that they need and its exact oxygen percentage, as opposed to some of previous devices that I used where you had a lot of sway in what you were delivering. We're also delivering that gas at what we call body temperature pressure saturated. So we're meeting the demands of what the patient requires to make sure that their lungs are getting that humidity and that humidification in the oxygen that they're breathing. And it's amazing sometimes how you put a patient on the Vapotherm system and you just watch them improve. You watch them get better. You watch their respiratory rate come down. You watch their oxygen saturation go up, and they're more comfortable. And that's our goal, right? In healthcare, is we want to treat patients and we want to make them feel more comfortable in that environment. I'm telling you, there is something distinct about Vapotherm and the high velocity that the other devices just are not capable of meeting. And people can say, well, it's high flow, it's high flow, it's high flow, but it's not. It's not just high flow. It is that velocity of the gas that truly does make the difference in how we ventilate and oxygenate our patients, and that's what it's about.